So we have a lot of patients who will, look online and find various Lyme gurus, and they have some kind of Lyme package, phase 1, 2, 3, or some kind of, there's a variety of protocols kind of out there. And I often get phone calls from people who go, I tried, Buhner, I tried Cowden, I tried all these other, I tried their, Lyme, I tried, whatever Lyme guru or book that they picked up. Often we'll have some kind of a, program or something. I tell people I will never yell at you for you trying to be proactive and help yourself in a, in a sick or sick state. The problem with doing one of these kind of programmed put together kits is it's not going to be super specific to you, and it's a little bit of a shotgun approach, which means the detox stuff may not be balanced correctly. I don't know if it has, if you have Babesia or Bartonella, does it have the Babesia or Bartonella part in it? And that's the biggest problem we find. So I have a lot of patients who have tried that. And if it works for you, wonderful. I'm glad you're better. I'm glad you're healthy. But I have a lot of patients who go, I've tried, one or two of those or multiple of those, and it didn't work for me. And that's where I think running the testing helps me be more specific for them and helps me go, oh, why didn't it work? The most common thing that I find for people who have tried these programs is that they're missing one of the co-infections. So what happens is they maybe have a test that says, hey, I had Lyme disease, and I had, XYZ. I had Lyme, Mycoplasma, Bartonella. Okay, great. Did a protocol. Did it work? Well, I don't feel better. Okay, but did it do anything? I'll retest them and find maybe it got rid of the Lyme, but it left the Bartonella and the Mycoplasma. So I would go, well, this helped you, but you still have two problems that it didn't fix, and that's why you haven't gotten all the way better the way that you like. Or vice versa, it can get rid of the Bartonella and leave the Lyme disease or something like this. So that's most often what we see, is that these kits, oftentimes what they do for people is they help do something, but they also fail at something, and only by tracking it can you really figure out, okay, that means I need to move you to more of a Bartonella protocol, or more of a Mycoplasma protocol, or more of a Lyme protocol, and you need to stop wasting your money on this stuff, and you need to focus in on over here. So that's really what we're kind of doing in the clinic, is trying to customize people's approach to what they really need. This is what's really hard. And I've talked to some of my colleagues who have books and programs and things. Whenever you write a book or put something online, I've even found this when writing articles or doing some of these, you kind of have to present it in a simple, straightforward way, like do this for 3 months. And in reality, if you talk to doctors who are, they go, can take anywhere from 1 month to 6 months, can have all this variability in it. But when I write it in a book or I put it in like a flow chart, I have to kind of make it a little simpler. I have to make it simpler and more straightforward. In reality, most patients take a lot of customization for, what's the dose, how long do you have to be on each step. This is also a question that we get, is how much is my treatment going to cost? And this is a very hard one for me to answer, because if you have, like, Lyme and Babesia is different than Lyme and Bartonella, or if you have 2 or 3 things, it's a little harder sometimes. Also, sometimes people respond really well. You give them things and then you retest them, and they knocked out 3 things at once in 4 months. And then some people, well, they have 3 things, you retest them in 2-3 months, they killed 1 of them, 2 of them are left. Okay, you adjust the protocol, and then you test them again, another one's gone, they still have 1. Okay, you do 1 for that next one, failed, 2 months more, didn't work. Okay, adjust again, 2 months more. So that took you 9 months to get all 3. So there's a lot of variability in how complicated a protocol is and the dosage that each person needs. So these are numbers that get very, very difficult for us to try and answer for patients until I kind of have a little more feel. Also, some people, you give them an herb and they need like a quarter teaspoon once a day, and that's all they can handle. They're very sensitive. And some people need like 2 teaspoons twice a day. And that kind of just is what it is. Your body needs what your body needs. And if you're not taking enough for your body, it's not going to be, beneficial. We try so hard at our clinic to try to project time frames and some costs, so when you get in here, you kind of can plan a little bit for it. But it's a very hard number for me to give in a general sense because there is so much customization for each patient in our clinic. This also, I think, is one reason why people like these outside kits. It's $250 a month. Try this for 6 months, see if it works. So you can kind of, budget it in a little bit, which I really do understand the appeal of. Unfortunately, we think it's much better results if you can customize, and you're going to probably not waste as much money taking stuff you don't need. I had a teacher who said the most expensive thing to do is the wrong thing. And that's really the attitude we take in the clinic, is we want to make sure if you're doing the right thing, that's going to be a faster and better route with less waste and less inefficiency than if you're kind of just guessing